If you catch rheumatoid arthritis early, you can prevent permanent joint damage. But many people miss the early signs, and that's where problems start. If you've been experiencing joint pain, stiffness or fatigue, and you're not sure what it means, this video is for you. I'm Dr. Bhadauria, consultant rheumatologist at Pure Rheumatology London, and today I'm going to walk you through the early symptoms of rheumatoid arthritis, how to recognize them, and what to do next. Let's start with the basics. Rheumatoid arthritis is an autoimmune condition. That means the immune system, instead of protecting you, starts attacking your joints, leading to inflammation, pain, and potentially long-term damage if left untreated. The key word here is early, because in the early stages, the symptoms can be subtle and often mistaken for something less serious. So what should you be looking out for? The first early symptom is joint stiffness, especially in the morning. This is one of the most important signs. If you wake up and your joints feel stiff for more than 30 minutes, sometimes even an hour or longer, that is not typical wear and tear. Patients often describe feeling like the hands are locked in the morning or that it takes time before they can move normally. This type of stiffness improves with movement, which is a key clue that inflammation is involved. The second symptom is pain in the small joints, particularly in the hands and feet. Early rheumatoid arthritis often affects the small joints first. You might notice discomfort in your fingers, especially the knuckles, or in your wrists. Some patients also feel pain in the balls of their feet when walking. What's important is the pattern. It's often symmetrical, meaning it affects both sides of the body. That's different from many mechanical conditions. The third early sign is swelling in the joints. You may notice puffiness, tightness, or visible swelling in your fingers or wrists. Sometimes rings feel tight, or you may struggle to make a fist. This swelling reflects inflammation inside the joint, and it's something that should always be assessed early. The fourth symptom is fatigue. This is often underestimated. Many patients with early rheumatoid arthritis describe feeling unusually tired even before the joint symptoms become severe. This isn't just normal tiredness, it's a persistent, low-energy feeling that doesn't improve with rest. That's because inflammation affects the whole body, not just the joints. The fifth early sign is reduced grip strength or difficulty with daily tasks. You might find it harder to open jars, grip objects, or perform fine motor tasks. This can happen quite early and is often a sign that inflammation is affecting joint function. Now, one of the biggest challenges is that these symptoms don't always appear all at once. They can come on gradually, and that's why many people delay seeking help. So how do you tell the difference between rheumatoid arthritis and something like osteoarthritis? This is a really important question. Osteoarthritis is more of a wear and tear condition. It tends to affect larger joints like the knees and hips, and stiffness usually improves quickly after movement. Rheumatoid arthritis, on the other hand, causes prolonged morning stiffness, often affects smaller joints, is symmetrical, and is associated with inflammation. Another key difference is age. Rheumatoid arthritis can affect people at any age, even in their 30s or 40s, whereas osteoarthritis is more common as we get older. So what should you do if you recognize these symptoms? The most important thing is not to delay. Early diagnosis is absolutely critical. There is something we refer to as a window of opportunity in rheumatoid arthritis, where early treatment can significantly reduce the risk of long-term joint damage. In many cases, starting treatment early can even lead to remission. At Pure Rheumatology London, we focus on rapid access and early diagnosis. During your consultation, we take a detailed history, examine your joints carefully, and arrange appropriate investigations. This may include blood tests such as Rheumatoid Factor or anti-CCP antibodies, as well as imaging if needed. But it's important to understand that rheumatoid arthritis is a clinical diagnosis. That means we don't rely on just one test. We look at the full picture. So what does treatment involve? Treatment has advanced significantly in recent years. we now have very effective medications that can control inflammation and prevent joint damage. These include disease-modifying drugs such as methotrexate, as well as biologic therapies in certain cases. The goal is to control the disease early and maintain long-term joint health. And the earlier treatment is started, the better the outcomes. One of the most common concerns patients have is whether these medications are safe, and that's completely understandable. The key point is that untreated inflammation carries its own risks, including joint damage and reduced quality of life. So treatment decisions are always about balancing benefits and risks and tailoring the approach to each individual. Another important point is that not all joint pain is rheumatoid arthritis, but if you're experiencing persistent symptoms, particularly stiffness, swelling and fatigue, it's worth getting assessed, because the cost of missing an early diagnosis can be significant. To summarize, the key early symptoms of rheumatoid arthritis are morning stiffness lasting more than 30 minutes, pain in the small joints of the hands and feet, joint swelling, persistent fatigue, reduced grip strength or function. If you're noticing these symptoms, don't ignore them. Getting the right diagnosis early can make a significant difference. If you found this video helpful, make sure to subscribe for more content on joint health and autoimmune disease. And if you're concerned about your symptoms and would like a specialist assessment, I see patients at Pure Rheumatology London. Details are in the description below. Thank you for watching.